Meanwhile, Singapore's vaccination exercise will be expanded to include those between 45 and 59 years old. If you belong in this age group, you can register your interest at vaccine.gov.sg, and the Health Ministry will send SMSs to the registrants as soon as there are vacant slots available for booking.
Now, a quick recap of yesterday's key announcements. From April 5th, up to 75% of employees can be at the workplace at any one time. Split team arrangements are also no longer mandatory, although companies may choose to continue to adopt them. Social gatherings like team bonding events will be allowed, but must be limited to 8 people.
And from April 24th, selected activities will be allowed to scale up further if they implement pre-event testing for those attending. For marriage solemnizations and wedding receptions, the limit will be increased to 250 attendees in total. For live performances, designated venues will be allowed to have up to 750 attendees. And for wakes and funerals where pre-event testing is not required, the cap will increase to 50 on the day of the burial or cremation only.
Let's hear what an expert has to say about the announcements. We are joined by Professor Teo Yik Ying, Dean of the Saw Swee Hock School of Public Health. Welcome back, Professor. Prof, yesterday's press conference was the first one in more than 2 months. What are your initial thoughts to the announcements? Did you expect more measures to be relaxed?
Thank you for having me. So I actually didn't have any further expectations about more measures being relaxed, because I felt that, as is in the case with most of the previous recent announcements where we announced that we will lift some of this restriction, it has been a balance between allowing more activities to resume, as well as to ensure that the risk of widespread community infections continue to be managed. So we have seen the limits for large-scale events, weddings, live performance. All this have been increased quite significantly, and there's even the waiver of pre-event testing for those who have been vaccinated. But what remains very clear is that we are still masked up, that every attendee is still expected to continue wearing masks and even in some degree of distancing, such as using the zones of 50 people. So I see this as a very clear attempt that we want to return to the usual level of economic and social activities, a big step forward, but still a very careful step.
Well, Prof, one thing that hasn't changed is the 8-person limit for social gatherings. What would it take for the government to, raise that cap? Because we've already seen several days with 0 cases in the community, and the number of unnamed cases in the past week has dropped to 0 as well.
Well, in many ways, I'm glad that this cap on 8 people remains. And I know it's not popular, but this is actually when people interact in close proximity settings without mask and often talking with each other for quite an extended period. This remains one of the highest risk activities that we know about. So I will be a lot more comfortable with relaxing this limit when many more people in Singapore have been vaccinated. At this stage in time, I think our vaccination is still below 1 in 5 people, or about 20%. It is still too early to relax this. So regardless of the community situation that you mentioned, there's not been many infections. And what is really worth reminding people is that Singapore did not need to turn on and turn off our various public health measures. We didn't have to go through another circuit breaker or lockdown, unlike many of the European and Asian countries. And that's precisely because we've been very careful whenever we make decisions to relax measures. Actually, if we look at what's happening in the world right now, in Europe, in Asia, in Latin America, many countries are actually experiencing rising numbers again, and cities have to undergo lockdown again. In Singapore, we have been fortunate we didn't have to, but that's because we've been very careful and cautious.
Prof, we are going to see an easing of restrictions for the workplace, with 75% of staff allowed to return and split team arrangements no longer mandatory. No easing of social distancing measures in schools though. Why do you think this is so?
Well, if we look at the main functions of the schools, from the perspective of education, training, including physical and mental well-being, development of values, social responsibilities, a lot of these activities have actually resumed already. So most CCAs, even day camps, have also been allowed to continue successfully. So what remains to be off limits are some of the contact sports competitions, some of the overnight camps, especially for the uniform groups. So kids are supposed to maintain some form of distancing during recess time as well. But in fact, a lot of the interactions between children, between the school-going children and their friends and teachers have resumed, and in a very safe manner. So in the beginning, my own children were complaining that they can't interact with their friends during recess, but I don't hear much about that now, because I think that there is quite a degree of interactions that now are able to continue. So presently, children are not eligible to be vaccinated. So I do anticipate that once the vaccines are established to be safe for children to take, and Singapore starts to offer the vaccines to children, a lot more measures that we currently have in place for the schools and for children will be reviewed and also be eased within limits.
Well, Prof, since the middle of this month, all seniors 60 to 69 years old could get their COVID-19 jabs. Now, we learned yesterday that 55% of them have received their vaccination or made appointments to get it. So what do you make of this progress?
So 55% is a very good number to start with. And I actually do think that this figure will continue to rise. I think we have to always remember that this is the first time that we're rolling out such a vaccination in a nationwide manner, and that a number of people who would have wanted to take may be asked to defer their vaccination because of concerns over allergies or their medical history. And I believe this cautious approach is necessary whenever there is a new vaccine that is being introduced to the community, especially in this national manner. And some people will suffer stronger side effects as a result of the vaccination. Now that we have more than 750,000 people having received their first dose, we are much more certain and confident of the medical profiles, the type of profiles that will likely suffer from some side effects. And in fact, there are profiles that previously we were very cautious with and we didn't want to give them the vaccine. Now we are much more confident that we can go ahead to offer the vaccine. So I do believe that the numbers, the percentages, even for the groups that we have already started vaccinating, the 60s and above, will continue to rise. And realistically, as more and more activities will be permitted for people who have been vaccinated, including the possibility of leisure travel, I actually think that more people will come forward to take up the vaccine when they are offered as well.
Professor Teo, thank you so much for coming on the show. As always, that was Professor Teo Yik Ying, Dean of the Sosui Hock School of Public Health at NUS.
What do you make of yesterday's announcements? Well, tell us and let us know in the comments section below.